Long COVID. Research priorities. To date, long COVID research has fallen short of meeting the urgent and scaled response this public health crisis demands. Most long COVID research to date has been observational, with comparatively limited investment in mechanistic pathobiology studies and rigorously powered interventional clinical trials. While the patient community has made our priorities clear, efforts seem to not move forward with the projects patients put forward, often leaving us seeing efforts repeated and funds wasted. Patients should be seen as partners in solving the very disease they suffer and live with daily. Our insights provide viewpoints many would never consider, potentially changing the entire trajectory and reliability of a project. We need accelerated development of novel and combination therapeutics, expanded autopsy and tissue-based pathophysiology studies, comparator research with SARS-1 survivors, and expedited decentralized national clinical trials to rapidly identify and scale effective interventions. We need long COVID research to explore advanced immunotherapies such as CAR-T and other T-cell-directed approaches, CRISPR-based strategies, next-generation antivirals, monoclonal antibodies, and additional novel therapeutics. Research should also prioritize prevention, post-exposure prophylaxis, and evaluation of extended treatment regimens during the first 1 to 3 months after acute infection to reduce progression to long COVID. We urgently need validated, reproducible biomarkers to stratify patients, define subtypes, guide treatment selection, and objectively measure disease activity and therapeutic response. Without biomarkers, diagnosis remains clinical, trials remain heterogeneous, and precision medicine approaches remain limited. Large comparative and longitudinal cohorts, EHR-linked population studies, and deeply phenotyped biobank tissue analyses are essential to identify risk factors, disease evolution, and treatment response patterns across diverse populations. We need long-term longitudinal research that follows patients for 10, 20, 50 years, across lifespans, to understand the full trajectory and downstream consequences of long COVID. SARS-1 survivors were largely lost to follow-up. We cannot repeat that mistake. Research is essential to restoring lives and preventing future harm. It requires sustained scientific interest, meaningful financial and personnel investment, community partnership, and durable infrastructure. Most importantly, it must be mechanistically grounded and centered on patient outcomes. We are all one infection away. Learn more about long COVID at longhauler-advocacy.org.